Chelan-Douglas Health District and the Washington State Department of Health doing to help those that are vulnerable and don't have access to the internet or may have language or other barriers? And this is another very good question. It's something that we are actually talking about and worrying about a lot all the time. Unfortunately, so far, we haven't had enough vaccine to do almost anything at all. For at least the last 3 weeks, we've had essentially zero vaccine coming in for new first doses. All of it has been going to the Town Toyota Center. So because we don't have any vaccine, it doesn't matter how many great ideas we have or great plans we have, we're high and dry on the beach, right? We can't do anything. Also, though, I want you to consider that, remember, the very best way to beat COVID-19 is to get as much vaccine into as many people possible as rapidly as possible. So mathematically, the best way to beat this pandemic is to vaccinate as many people as possible as quickly as possible, right? And to do that, what we need to do is to have people come to us, come to where the vaccine is. And now I'm just talking about mathematics and how to get things done as rapidly as possible, right? So imagine if I have 10 healthcare workers and I've got a line of people who are interested and qualified to be vaccinated, they're lined up in front of me, I can vaccinate 1,000 people a day. I can vaccinate huge numbers of people when they come to me. Now, if I need to go out and find and vaccinate people who don't have the ability to come into the Town Toyota Center, who have language barriers and other barriers to signing up on the internet, with those same 10 healthcare workers, I can vaccinate maybe 20 people in a day. So as far as an effective utilization of a very limited resource, and that is our healthcare workers, the quickest way to get it done is at a central site like the Town Toyota Center and have the people who can make it there, go there and get vaccinated, right? So then what we have to do though is that and. So we need to do the mass vaccination site and we need plans to go out and to help people who can't come in or who have barriers to coming into the Town Toyota Center. And we've got lots of good ideas. We have strike teams that are ready to go out into agricultural sites and to go out to the schools. We have healthcare workers who are standing by at Confluence and at Columbia Valley and at Cascade and in Chelan, so that when the vaccine does come, we, the healthcare providers, the healthcare delivery systems, can actually call our patients in. So I can generate a list of all of my patients who are over the age of 65, and I can invite them to come in so that we can vaccinate them. And that's what we have been doing when we've had vaccine, but right now we've got no vaccine. So please rest assured, as soon as we've got the vaccine, we're going to be reaching out to people who cannot access the vaccine at the Town Toyota Center. And that's super important to us. Okay. And then another issue is just today, I just heard that the Chelan-Douglas Health District and CAFE have established and will cooperate in a COVID appointment assistance line. And that's going to be launched today. And today is Wednesday, February 10th. And this team is going to identify community members who have barriers to accessing the internet or who have language barriers, who are in the correct phase and should qualify for the vaccine. And they're going to help signing those people up and working into the scheduling system at Town Toyota Center. So I'm going to give you the phone number. So I want you to get a pen. And the phone number is 509-715-3108. So again, 509-715-3108. And that is the language line, which is being put together by CAFE and the health district to assist people who are having challenges getting into the schedule at the Town Toyota Center. ¿Qué están haciendo el Distrito de Salud de los Condados de Chelan-Douglas o el Departamento de Salud del Estado para ayudar a los vulnerables que no tienen acceso a Internet, el idioma u otras barreras? Desafortunadamente, hasta ahora no hemos tenido suficiente vacunas para hacer mucho. Este es nuestro plan grande, que la mejor manera de vencer el COVID-19 es administrar la mayor cantidad de vacunas a la mayor cantidad de personas, a la mayoría, de personas lo más rápido posible. Matemáticamente, la forma más rápida de vacunar a la mayoría de las personas es hacer que esas personas vayan a donde está la vacuna. Si tengo 10 trabajadores de salud vacunando personas y tengo una fila de personas esperando ser vacunadas, puedo vacunar a cientos de personas todos los días. Si tengo esos mismos 10 trabajadores de la salud que necesiten hacer visitas domiciliarias para vacunar a las personas que no tienen automóvil o no tienen acceso a Internet, puedo vacunar a unas 20 personas en un día. Entonces es mucho más rápido a vacunar gente quien puede venir a nosotros. Entonces, tener un sitio como el Town Toyota Center que puede vacunar a 1,000 personas por día es muy importante en la lucha contra COVID-19. Dicho eso, sabemos que el proceso, el Town Toyota Center, es realmente difícil para mucha gente. Nuestro primer plan fue pedir a los proveedores de atención médica locales como Confluence Health y Cascade Medical Center y la clínica de Columbia Valley Community Health que vacunen a sus propios pacientes que han encontrado desafiante el proceso del Town Toyota Center. Todos estamos locamente frustrados en este momento porque el Estado no nos ha enviado ninguna vacuna para permitir que nuestros proveedores de atención médica hagan eso. Así que en este momento estamos trabajando en un plan para que los proveedores de atención médica ayuden a sus pacientes haciendo la programación por ellos en Town Toyota Center. Una vez que tengamos suficientes vacunas, esperamos tener sitios de vacunación en Chelan, y Leavenworth y Wenatchee, y tendremos equipos de huelga que irán a las instalaciones agrícolas, las escuelas y los sitios de alojamiento y los trabajadores agrícolas. Entonces, tenemos muchas buenas ideas para ayudar a las personas con barreras para usar el sistema actual. Y tan pronto como obtengamos un suministro estable de vacunas, comenzaremos a hacerlo. Y hoy descubrí que el Distrito de Salud y Café han establecido y juntos operarán una línea de asistencia para citas de COVID que se lanzará hoy. Hoy es miércoles, el 10 de febrero. Este equipo identificará a los miembros de la comunidad que tienen problemas de acceso y se encuentran a la fase correcta y los ayudará a programar una cita. Café ha asignado una línea telefónica Y si usted tiene su pluma, tengo aquí el número. Es 500, lo siento, 509-715-3108. Otra vez. 509-715-3108.